Good morning, everyone. My name is Bridget Cole, and I'm Programs Manager with Nevada Cancer Coalition. I would like us all to take a moment to go around and introduce ourselves. So all the people on the phone, if you could introduce yourself, that would be great.
Yeah, so we'll start off with Sharon.
Sharon McGinnis, cancer survivor, diagnosed Thanksgiving Eve of last year. Lymphoma. I don't know what else to say.
Thank you, Sharon. Thank you for joining us today.
And the next, it's OOP7074.
Hello, my name is Eileen. I'm a nurse navigator in Las Vegas. I handled GIG on Euro.
Great.
Hi,
Good to have you today. Thank you.
Thank you.
And then Alethea Rudd.
Hi, it's Tia. Can you hear me?
Yep.
Okay, great. And I am a contractor, self-employed contractor in public health and nursing to the Nevada Cancer Coalition now. And a survivor of my sister who just died of breast cancer.
Well, thank you, Tia. Thank you for joining us.
Barry Cole.
Morning, Barry Cole, retired physician and survivor as well. Thanks.
Thank you, Barry.
Judy. Judy, do we have audio for you this morning? Maybe no microphone there. Then Elle Harrigan.
Hi, good morning. Can you hear me?
Yep.
My name is Lorraine Harrigan. I'm actually out of Folsom, California, and I am a 20-year Hodgkin survivor, and I also work for Insight Corporation as an oncology therapeutic specialist.
Great.
Thank you.
Good to have you today. Thank you.
Good to have you.
And Denise R.
Can you hear me?
Yep.
Hi, good morning. I'm a cancer care coordinator with Access to Healthcare.
Good morning, Denise.
Great, thank you. Now it looks like we had Dr. Robin Palmer just join us. Could you introduce yourself, Dr. Palmer? I have you off mute. We should be able to hear you. Okay, maybe no audio there for Dr. Palmer. So we'll move on here. First off, I want to see if anybody has any specific questions they want to ask. Any cases or any questions you want to ask of our team here? Feel free to take yourself off mute or write in using the chat box.
I'll go ahead and get started.
Dr. Palmer has a question on the role of sugar. Dr. Palmer, could you expand on that a little bit more? While we wait for that, yeah, let's do our introductions.
Okay, perfect. So a little bit about why we have done this Cancer Survivorship series. So the coalition, in collaboration with Project Echo Nevada, is providing this series to primary care providers as an introduction to issues in cancer survivorship. So today, more than 2/3 of those diagnosed with cancer are told that they can expect to live at least 5 years after diagnosis. According to the American Cancer Society, in Nevada, there are currently an estimated 120,200 cancer survivors. And in 2019, 14,810 people will be diagnosed with cancer. So this series really hopes to address survivors' ongoing needs with improved outcomes and quality of life for cancer survivors. So I would like to introduce you to today's presenter. Her name is Susan Chapman. She is a registered dietitian nurse, registered dietitian at St. Mary's Hospital since 1996. She's been working on the oncology unit for 15 years. She's a certified nutrition support specialist, and she's involved in Empower Your Journey Cancer Program at St. Mary's. She graduated from University of Massachusetts, Amherst, and completed her didactic program for dietetics at University of Nevada, Reno. So without further ado, we'll go ahead and get started, and Sue, you can take it away from here.
Thank you everyone for joining, and thank you Bridget and Troy for having me today. My goal today is to talk about nutrition and its role that it plays with cancer survivorship. This program was developed at St. Mary's when they developed their Empower Your Journey series, and that's how it started. I do work with inpatients in the hospital, but this Empower Your Journey series at St. Mary's has allowed me to work with patients outside the hospital, and this talk was developed to provide nutrition advice that has been evidence-based. And a lot of the talk is from the American Institute for Cancer Research, and there are 10 nutrition recommendations for prevention of cancer, as well as the American Academy of Nutrition and Dietetics Oncology DPG group. So without further ado, we'll go ahead and get started. Our objectives for today is to understand research evidence-based recommendations from the AICR WCRF on nutrition and cancer. Again, recommendations also are from the Academy of Nutrition and Dietetics Oncology Practice Group, and I want to help people people today that are calling in to provide useful application and goals for nutrition when they're working with their patients, and to confirm healthy nutrition practices and hopefully provide some ideas for applying nutrition recommendations. So the recommendations are listed here. I will just briefly go through them, and then we'll be talking about each one of those. That's okay. Well, actually, the second part of that slide, there's two parts to this program that I developed, and the first part is reviewing the recommendations, and the second part, if anyone is going to be trying to incorporate any nutrition talks into any of their programs, I developed it where I talk for 45 minutes, and then we have a food demonstration, and it helps people kind of talk amongst each other. It helps me to provide more information. We do a food demonstration and do a little cooking, and it helps to talk about kitchen tips, cooking tips. People start to coordinate with each other, and they get a little bit more relaxed. And it's been a great, I think, asset to the second part of the talk because we get a lot more information that people can talk to each other as well and get some ideas of what they've developed and their home nutrition program. And then they continue to ask questions to me as well. So I think it's been a good setup. So when I provide the first part of the presentation, we talk about being a healthy weight is the first area. Physically active is number 2. Eating a diet rich in whole grains, vegetables, fruits, and beans. Limit consumption of fast foods and other processed foods. Limit consumption of red and processed meats. Limit consumption of sugar-sweetened drinks. Limit alcohol consumption. Do not use supplements for cancer prevention. Breastfeeding, and after cancer diagnosis, follow recommendations. And these recommendations are the newest 2018 continuous update project recommendations from the American Institute for Cancer Research. So again, I provide some cooking tips, kitchen tips, tips for healthy eating. We do a little hands-on demonstration, and I usually do a smoothie recipe because the cooking is a little bit hard to do. So the smoothie works out great, and then we get to incorporate some of the different ingredients and talk about other ways of incorporating quick nutrition tips, healthy nutrition tips for participants. So being a healthy weight, keeping your weight within a healthy range and avoiding weight gain in adult life. I think a lot of the focus these days has been avoiding that weight gain in adult life. Sometimes in fast-paced times, we are losing maybe where the priority is with weight. Everybody's quite busy, and sometimes before you know it, we've put on a couple pounds, and that, again, is going to be something we're going to focus on today, avoiding weight gain in adult life and staying in a healthy range. Because next to not smoking, maintaining a healthy weight is the most important thing you can do to reduce your risk of cancer. You want to aim to be at the lower end of your body mass index, and that may require some assistance from people and where people should be. The recommendations are based on where your BMI was from after the age of 21. So how does being overweight increase your cancer risk? There's a lot of discussion on that, and a lot of the information is based around insulin and the increased levels and increased insulin growth factor 1 that comes along with having our excess body fat. So body fat just doesn't sit on our bodies. It's actually actively producing these hormones that are being released into the bloodstream. And that in turn can increase our risk for growth of cancer cells. A lot of information is being discussed about where our body fat is. And for example, women who, postmenopausal women who have their adipose tissue more around their waist or are at increased risk for cancer as well because of the increased site for making estrogen. The bottom line to all of this is inflammation. So being overweight is linked to inflammation. So I think a lot of the recommendations today are going to be based on how to decrease our inflammation. Being as lean as possible without being underweight, increase lean body mass, reduce adipose tissue, which involves the next couple slides when we briefly talk about physical activity. People are less likely to develop cancer as well as other chronic diseases. People are living longer with cancer, and a lot of cancer survivorship goals are to prevent other chronic diseases as well as cancer prevention. So again, our goal is a healthy weight achievement. The take-home message when I'm working with participants that come to these classes are this has kind of been a time where we really focus on helping individuals make their goals for the future with their nutrition. It's a time to kind of heal and to really say what are my goals for nutrition, what do I need to focus on, and congratulate yourself for what you've been doing. And so I like to incorporate that into my talk. Trying to avoid the strict word dieting and the stress that comes with it, because what comes with stress is inflammation. So when in remission or not undergoing cancer treatment, modest amounts of weight loss can help reduce your risk of cancer. So when people are asking what numbers are we using, waist circumference for men is less than 37, and for women 31.5. We had a great presentation earlier on physical activity. Always consult your doctor before beginning any exercise program. But I do want to briefly touch on it. It is part of the 10 nutrition recommendations. And I think it ties into, each number ties into each other that we're going to talk about. And I think physical activity and maintaining a healthy body weight go together. So physical activity in any form helps to lower risk. There's a lot of information a lot of studies coming out of just basic walking and getting outside. Trying to incorporate 5 or 10 minutes here and there can be very helpful. Aiming to build more activity, like even brisk walking, like I just mentioned, into your routine. The recommendations that were discussed earlier on in the series are a minimum of 150 minutes moderate or 75 minutes of vigorous activity a week has been recommended. And for cancer prevention and weight control, you may work towards making that up to 60 minutes daily. I think there's 45 minutes to 60 minutes of moderate intensity. I think that when people are working at physical activity, when you've discussed this with your primary care team, you want to reevaluate how you're doing after meeting goals, and regardless of your BMI, being active in itself helps to prevent cancer, because not being active is a risk factor as well. I encourage participants in my program to really just try and decide what activity they're able to do, as well as what do you enjoy. So there's ways that we can incorporate physical activity without going to the gym, and there's a lot of things that people can do even in their home while watching TV, being on the treadmill, being on a bike, taking the stairs, being more active in your house. So if you're not able to be extremely active, there's other ways to reduce sitting time. So you don't have to go to the gym, as we spoke about, but basically, how does physical activity reduce the risk of cancer, and how does it tie in with nutrition? It ties in with nutrition because it can reduce your weight gain and help with weight loss. It can promote healthier levels of hormones. It can help with your immune system, which reduces your risk for cancer. It can help with healthier levels of fat, and it can also speed up gut transit time, which also has a health benefit. One of the most exciting discussions, I think, these days is plant foods. And plant foods and recommending more of a plant-based diet does not mean you can't eat meat, but we're going to emphasize right now on plant foods, whole grains, vegetables, fruits, and beans. And I think the most exciting area of research for plant foods is the potential for phytochemicals and what they can do for us. Phytochemicals are your plant compounds that can potentially stimulate your immune system, prevent substances from becoming carcinogenic, what we eat, what we drink, what we breathe. Can help reduce inflammation and reduce cancer growth. Throughout this talk, you'll hear the term inflammation used. Preventing DNA damage, assist with repair. Reduce oxidative damage, prevent reproduction of damaged cells, and help regulate hormones. So there's a lot of exciting future coming, hopefully in the future, for phytochemicals and the emphasis on eating more plant foods in your diet. What makes plant foods protective against cancer? More specifically, they have potential to offer protection in specific areas. So trying to eat from what we always say, the rainbow, the different color fruits and vegetables, really can have an impact on your overall health for cancer prevention. The non-starchy vegetables and fruits, we include our dark green, orange, and red non-starchy vegetables that potentially can reduce your risk for cancers of the larynx, lung, and stomach. Reduction of cancer for stomach are your allium vegetables, garlic, onions, and leeks. So we're going into a variety of these foods. Colorectal cancer potential for garlic and foods that contain fiber. There is a stronger correlation with the reduction of colorectal cancer with fiber intake, as well as whole grain consumption. There's a little bit more evidence with fiber right now. Prostate cancer, your lycopene products, again, these are all foods that are rich in phytochemicals. Prostate cancer, there's still a lot of ongoing research about this, and the evidence is leaning towards using cooked tomato products and combining it with other vegetables as well, like broccoli. So one item is not going to provide that protection necessarily. It's going to be incorporating all of these different foods and the colors of the rainbow into your diet. And that's kind of the goal of the discussion on the plant foods. Incorporate variety, try different vegetables and fruits. Your stronger, more darker colored vegetables, maybe a little stronger in phytochemicals. Use plant foods and your vegetables, fruits and vegetables. Cook them, but also eat them raw. Some of the phytochemicals are more released when you're cooking them, but not overcooking them. So there's a lot of little tidbits that we can discuss, or you can discuss with your patients as well.
So there's a few questions that have come in that I want to have us address. So at the Cancer Summit a couple years ago, a speaker explained the role of sugar in fueling cancer. Not specifically regarding overweight, but the role of sugar directly. Is there a known risk, increased risk for cancer with increased insulin levels, such as in diabetes, or insulin spiking with sugar ingestion?
So they all tie in together. There is not a direct link with sugar intake that research has shown, but the indirect link with the added sugars in your diet can increase your insulin levels, insulin growth factor levels, and that in turn can increase different risk factors. Could you go back to that first question again? Sorry. So again, it's going to go back to the added sugars and the role that insulin is increased with added sugars and added sugar in your diet. Again, that can lead to the obesity, overweight, which again can increase your risk for diabetes and prediabetes. The increased insulin production and the increase in other hormones that aren't as helpful for you has been shown indirectly to increase your risk for cancer. So the link is not direct, but it's indirect.
How important is eating only organic plant foods? Is eating plant foods the point, or must they also be organic?
The American Institute for Cancer Research has not linked a reduction, as far as I know, of cancer that it has to be organic. I think the organic is a choice for each individual person. There's a lot of factors that go into it, an organic food, and so it might be more of a personal choice. But as far as I know right now, there is no direct link with the American Institute for Cancer Research that I've seen.
And then what about sweet potatoes? Are those too starchy?
Sweet potatoes have a lot of phytochemicals, a lot of beta carotene. I don't believe that they are too starchy. It's going to come down to how much of it is in your diet, but how much overall carbohydrates, but it is not an added sugar. So I feel as though for recommendations, for patients that sweet potatoes are not too starchy. They offer a lot of other phytochemicals and benefits for participants or patients.
So back to the question about sugar and cancer and diabetes. Is there an increased risk for cancer with diabetes or prediabetes that you know of?
Is there an increased risk with cancer for diabetes? Is that the question?
I believe so, yeah.
So if you have cancer, is there a risk and increased risk of diabetes?
No, I think the other way around. If you have diabetes, you have an increased risk.
I do not know of
cancer.
any. I do not know of any.
Okay. All right. Thanks for the questions, everyone.
I will go back to that question. If your blood sugars are, I think that if you have diabetes and pre-diabetes, it would be important to keep your blood sugars in good control.
All right. Thanks for the questions. We're going to move on, but please feel free to keep writing them in, and then we'll get to those in just a little bit here.
So the American Institute for Cancer Research, they have come out with a new American plate, which is a recommendation for how to incorporate and make a plan for your nutrition intake of eating 5 servings a day of a variety of non-starchy vegetables and fruit, eating unprocessed grains or legumes with each meal, reduce and limit consumption of refined starchy foods, and provide plant protein sources in your diet. So the new American plate is one way to look at how your plate is and how much nutrition, how much fruits and vegetables you're incorporating at home. So, and for participants, if you're trying to educate people, this is probably, to me, the easiest one. There's a group of diets out there, the Mediterranean diet, the anti-inflammatory diet, the DASH diet, and they all have a commonality, but this one from the AICR provides kind of a real basic look on your plate of 2/3 or more of vegetables, fruits, and whole grains and beans, and 1/3 or less of animal protein. So if you're working with participants or patients and you want to discuss how their plate looks now or what their goals are, I think this is a helpful hands-on or kind of visual aid for people and participants. So 2/3 or more, again, of vegetables, fruits, and whole grains. You don't have to eliminate animal protein from your diet altogether. Limit consumption of fast foods and other processed foods. Limiting these foods can help control and maintain a healthy weight. If you're using a lot of fast foods and other processed foods, there is an increased risk for overeating. Strong evidence that consuming these foods are causes of weight gain, overweight, and obesity, which are linked to 12 cancers, which is 5 more than a decade ago. A lot of the fast food places are trying to come out with a little bit healthier items, but if this is a processed foods, the intake tends to increase. There's a lot of drinks, and the sandwiches and the side go together, and I think, for a special that can, a good price, then if somebody was going in to get a sandwich, they end up with a soda and they end up with a side dish, and their calories can go up and, again, increase your risk for weight gain. The 12 cancers that it has been linked to are more of your head and neck, and then your GI and your female cancers such as ovarian and breast, and then liver and prostate. So those are the areas. So why red meat and processed meats, and how does that increase your risk for cancer? The recommendations are, if you eat red meat, to eat less than 18 ounces a week. Poultry, fish, eggs, and dairy products may be better alternatives than red meat. Any amount of processed meat has been shown to increase the risk of cancer. And their recommendation is to avoid all processed meats if possible. And the reasons being with the red meat is we've got the heme iron in the red meat that can help with, or the red meat actually, the heme in the red meat can promote inflammation, oxidative damage by producing free radicals. It also produces the N-nitroso compounds, helps to formulate those. The nitrates in the processed foods are formed from those compounds, and all of those have been shown to increase the risk of cancer. Those are theorized possibilities of mechanism for red meat and how it can increase your risk for cancer. Limit consumption of sugar-sweetened drinks. Drinking mostly water and unsweetened drinks, avoiding sugary drinks, and promoting of overconsumption of calories can happen when we are taking in sugary drinks. They don't tend to fill you up. They are full of a lot of extra calories and sugar, and we don't tend to eat any less if we're keeping those in our diet. We tend to overeat on, we tend to overconsume on calories.
Question here about, what about smoked fish?
Smoked fish also is included in the risk for cancer. They're all included: salted meats, smoked meats, cooking at high temperature. So those are all suggestive to increase your risk of cancer. The mechanisms that I talked about before, the increase in nitrates, the increase in the nitroso compounds, have been theorized to promote cancer. So how does alcohol increase cancer risk? I'm going to move forward for just a minute and say for cancer prevention, it's best not to drink alcohol. If you do choose to drink alcohol, limiting your consumption to 1 drink for women and 2 for men is the recommendation. Ethanol is metabolized to a carcinogen, and it helps to facilitate that carcinogen into the cells and damage the DNA. So the more you drink, there's an effect of the more you drink, the increase in risk for cancer as well. If you are consuming alcohol with tobacco, that also magnifies the risk as well. Again, for cancer prevention, it's best not to drink at all, and 1 for women and 2 drinks for men if you do consume alcohol. 1 drink is 4 to 5 ounces of wine, a beer, and an ounce of alcohol, hard alcohol. Some supplements increase the risk for cancer. The study that has been presented in the past is that beta carotene in high doses increase the risk of lung cancer for patients who smoked and were current smokers. So we want to aim to meet nutritional needs through diet alone. The panel does not discourage the use of multivitamins or specific subsections of the population who stand to benefit from them. Examples are childbearing age and the elderly population. Also for cancer patients that may be taking medications, that there may be a decrease in certain lab values where you might need to supplement. That's somebody who might have malabsorption. But there's caution against expecting any dietary supplement to lower cancer risk as well as a healthy diet can. And always consult your doctor or dietitian before taking any type of supplement. So we're really encouraging our participants, our patients, to eat your variety of fruits and vegetables, greater than 2.5 cups a day. You might use examples of a cup of fruit at breakfast, a cup of vegetables at lunch, again at dinner, and having fruits and vegetables as a snack. And these all can help get our nutrition versus using supplementation. In addition to that, I wanted to mention that the whole grains also can provide some additional nutrition as well.
Can you name some of the supplements that people take specifically, if erroneously, to decrease cancer risk?
I think some participants potentially, some of the vitamins and supplements that are being studied may be taken in excess. And I can't answer that for sure, but things like areas of resveratrol, maybe being cautionary with taking omega-3 might be something that a patient is doing. Supplementation of, let's see, green tea is another area of discussion where people have to be careful of how they take it. The evidence is not quite there yet, and so maybe people are taking these products and increasing the amount that they can have. It's not that they're not helpful, but the amount has not been shown to be safe at this point.
One example I can think of is turmeric has become very promoted as an anti-inflammatory, and the curcumin that's in turmeric. So is that something that, you know, is there any evidence behind that, or?
The evidence is pointing towards it being a great anti-inflammatory product to use in your foods and spices. But that's a great point, that using it as a supplement, one would need to be careful of versus using it in your food. Things like that. Ginger, same thing. Is it safe to use in a capsule form or food form?
And any comments on the role of vitamin D?
Vitamin D can be decreased with cancer. In cancer treatment, there may be a risk for decreasing vitamin D and the need for supplementation.
In terms of the vitamin D, sorry. I'm like, oh, now I've got a question. In terms of the vitamin D, I know I thought I had seen a study at some point come out saying that low vitamin D levels can also lead to breast cancer. Is that something that you
I think that there's not enough evidence right now, but there is, it is being linked to low vitamin D levels in a couple other cancer risks, like colorectal cancer. That has been an association that I've seen. I don't know about breast cancer risk as specifically, but the risk for cancer in general with low vitamin D is being studied.
Thank you.
The greater amount of time a mother breastfeeds, the lower risk for pre- and postmenopausal breast cancer. The recommendations are to breastfeed exclusively for the first 6 months. It provides the baby with immune protection, as well as becoming, for that baby, overweight later in life. It also provides the mother protection against pre- and postmenopausal breast cancer. Cancer survivors, it refers to those diagnosed with cancer, including those that have recovered from time of diagnosis and forward. So after treatment, there may be special needs that you may want to work with your patients on. The ability to consume or metabolize foods may be altered with treatment. Recommending or working with your patients, I always encourage the counseling with a health professional, and recommendations for these 10 recommendations are to be followed by cancer survivors from diagnosis and on. Emerging topics, I see there's been some questions, and thank you for that. Omega-3 fatty acids are emerging topics. Soy foods, flaxseed, green tea, does sugar feed cancer? So these are questions that have been emerging topics, as well as there's many others, what diet to follow. Omega-3 fatty acids are very beneficial. The research itself coming out on protection of cancer, I think, is still pending. However, if you're incorporating omega-3 such as fish into your diet twice a week, is the recommendation, you are probably decreasing your intake for other more unhealthy foods, and that in turn can help promote cancer prevention. We can go through these. Soy foods, there are no specific there's no evidence showing that eating moderate amounts of soy foods can increase your risk for cancer. The association does not recommend soy protein isolates or taking supplements in that way, but incorporating soy foods, 1 to 2 up to 3 servings a day of real soy foods has currently not been, is showing more positive than negative. The omega-3s, if you don't eat fish, are in flaxseed, which also contains your omega-3s in the plant form. And green tea, I mentioned, some people, there's evidence pointing towards inhibiting cancer. It may potentially be used in the future as something recommended in adjunct therapy, but one has to be careful of medications that you might be on and how much are we going to recommend. We don't know that answer yet. And we don't know all the results of the green tea at this point, but it is showing to be a powerful antioxidant, more than vitamin C, more than vitamin E. So it's a very powerful antioxidant because of the EGCG ingredient in there. And I think at some point there will be some promising information coming out, but at this point, we don't know. So, and does sugar feed cancer? We were talking about that. If there's more questions, I'd be happy to talk about it.
And Robin, this is Bridget. Just to answer your previous question, I can't remember the name of the presenter at the Control Summit a couple of years ago, but I will definitely, when I get back to the office, get his name for you and send it to you.
I think there's 1 or 2 more slides. Okay. When I'm working with participants and patients, and we do the food demonstration, we talk about recipes and tips for healthy eating, cooking tips, sauteing your vegetables, using some of the healthy fats with your fruits and vegetables can help absorption of some of the phytochemicals. We talk about ways to make this happen, ways to make these recommendations be able to be incorporated into your diet. My participants ask questions, they share with each other, and the goal is to try and find areas that patients or participants can increase their fruits and vegetables, eat those whole grains. And it's a great discussion forum, so if people are trying to incorporate a nutrition program in there, I think this has been a beneficial area, beneficial addition to the presentation. I talk to patients about looking for frozen or canned vegetables or beans that can be heated up quickly. There's frozen brown rice, quinoa, whole grains. The whole grains, I don't know if I touched enough on. If people are interested in a variety of whole grains that have a little bit of protein, if you're trying to decrease some of your meat intake and you want to keep your protein intake up, there's a lot of whole grains like quinoa, teff, that are out there on the market that I encourage people to try varieties of whole grain instead of just sticking with one area. They're very easy to heat up. Amaranth is another one, and some of them do include a little bit of protein and different vitamins and minerals as well. Cooking in advance for easy heat up might help with someone who fatigues quickly. and planning ahead, doing most of your things when you have more energy. Those can be helpful tips for someone who, again, has maybe limited time to prepare foods.
So we've got some time for questions here. So if anybody has any, please write those in.
Well, thank you so much, Sue.
Thank you.
Yeah.
Do you want to talk about the summit real quick and then the next session?
Yes. So thank you so much, everyone, for joining us. And thank you, Sue, for presenting. This was just a really wonderful presentation and super informative. So, mark your calendars. We have our upcoming Nevada Cancer Control Summit. It's going to be on September 16th, 2019, here in Reno at the Whitney Peak Hotel. So we're going to have many wonderful presenters on many different topics across the cancer spectrum. And then our last clinic of this series is going to be held May 24th. And our final presentation is going to be on lymphedema. And it's going to be presented by Douglas Herring, who is a physical therapist at St. Mary's Regional Medical Center as well. So thank you so much, everyone, for joining us. And we hope that you have a wonderful Friday and enjoy some sunshine.
Thanks, everyone.
Thank you.
Thank you.